Hi, everyone, and welcome back to another one of our live Q&A sessions. I'm Dr. Samantha, the maternity mentor, and we're here every Monday at 9 p.m. Eastern Standard Time to answer your questions live, as well as questions you might have put onto some of our videos this week. Remember, we're also on Facebook, Instagram, and Twitter for additional content. We link those into the video description. Please like and subscribe to the channel. It's really, really, really helpful to us. And hit the notifications bells so you can get notified of our latest videos coming out. And we'll give you a sneak peek at the end of tonight's live at tomorrow's new video. Remember, share the channel with your friends and family. And, again, we look really forward to interacting with you guys tonight. So please remember to put all your questions into the chat and we're going to get to them live. I always start out as we're getting going with some of the questions that you guys have submitted onto some of the videos this week. So I'm going to go ahead, and we had some really interesting ones this week. I always like to start with bleeding. Bleeding is very, very scary for a lot of women, and I think it's a really important subject to address. The first comment that we had was, I am 7 weeks pregnant and I have light brown spotting that started in the 6th week. Then it turned dark brown, and today at 7 weeks, it's maroon and burgundy. Please guide what's happening. It has also been diagnosed as an empty sac pregnancy in week 6. So I love to start out with this question because it highlights some of the importance of understanding what colors the blood means. And we have a video on this that we can link into the description and you guys can reference back. But basically, the darker colors like brown and black are usually old blood, and the red colors are usually a sign of active bleeding. And of course, active bleeding is something we're a lot more concerned about. Now, one of the things that this viewer mentioned is that it's been diagnosed as an empty sac pregnancy. Well, what does that mean? An empty sac pregnancy can also be an embryonic pregnancy. That means no embryo, no baby, or a blighted ovum. And all this means is that the placenta and the actual amniotic sac developed, but a baby did not form. Okay, there was an error in that process. But this blighted ovum does send out the signal that you are pregnant. It releases HCG, the human chorionic gonadotropin hormone. So you will test positive for a pregnancy, even though you are not actually pregnant with a live baby, right? Now, you still have to pass that embryonic sac, that blighted ovum. It has to pass out the body. In essence, you have to have a miscarriage. And so when your blood is going from this darker color to this like more bright red color, that is probably the start of your body's process to get rid of the blighted ovum. Now, it usually passes just out. You might see a little blood clot. That's usually what the blighted ovum looks like. It just depends. And it usually will take about 7 to 12 weeks before you actually have that pass. So you're right around the time that it would be expected for you to start bleeding. If your bleeding becomes heavier and heavier, you start passing lots and lots of clots, you have any kind of complication whatsoever, you need to go to your healthcare provider and let them check you out. Otherwise, they consider this to kind of be a normal part of the process. And, you just want to keep an eye on things. The next question that we got on bleeding was, I'm 15 weeks pregnant today, and at 4 a.m., I was bleeding when I was in my sleep. At 10 a.m., I went to the doctor. He said, due to heavy work, it just happens. Bleeding stopped after 4 a.m., and there's no spotting. But I'm worried. Please guide me. I had a miscarriage before at 8 weeks last year. So I think this is a great question to kind of bring up. So what this person is saying is that she started bleeding at 15 weeks. And when she went to her doctor to get assessed, they said, heavy work causes bleeding. So this is an example of a very legitimate cause for bleeding that can be prevented. We all live in a very busy, crazy world. We have a lot of responsibilities, But it's very important for you guys to understand that you need to take it easy when you are pregnant. One of the things that I really go back to a lot with my patients is the idea that we are all cavemen, right? So, this idea that we were actually, living in caves, like our genetic ancestry comes from there. And when we were genetically in caves and pregnant, we did not have to do all of the things that we do now. We did not have to go grocery shopping. We did not really have to do laundry, not like in the concept that we have now. We didn't have to work 9 to 5s. Yes, we had a lot of responsibilities and life was not easy, but it was different. And when women were pregnant, the other women in the village supported you. So your load was lighter. In today's day and age, you have to work to put, food on the table, then you have to work. But as much as you can, you want to try to take it easy when you do get home. Take breaks, rest, listen to your body. Heavy lifting, generally speaking, is not something we want you to do during pregnancy. Of course, every pregnancy is different and every mom is different. So you need to ask your healthcare provider for them to give you those guidelines. But generally speaking, it's one of those things that you should be kind of limiting how much you're doing. A lot of people ask, well, what is the guideline? Again, you need to ask your healthcare provider. I've heard anywhere from 5 to 10 pounds. It also depends on the repetitive nature of the lifting. It depends on, what's going on. And at the same time, if you work a job that requires some heavy lifting, they may give you completely different guidelines. For example, they may tell you, okay, when you're working, fine. But as soon as you get home, nothing. So it's one of these things that you want to make sure you're having a frank conversation with your healthcare provider about what heavy lifting looks like for you. And also, don't be afraid to ask for help. So, for example, we have local grocery stores that will pack your groceries and put them into your car. Let them do that for you. That's what they're there for. Take advantage of that convenience. These are little tiny things that can help make a big difference on the strain that you have on your body. Okay. So the next question that we got a couple questions on our Rogan video. So let me go ahead and talk about those. So the first one was, hello, ma'am, I had a miscarriage right now. How much time should I wait before I receive the RH shot? She means the Rogan shot. And the next question was, I'm RH positive with negative antibodies. I found this out today after testing. I'm curious what it means. So these were two great questions that kind of encompass RH. So let's go through it. We all have a blood type. Okay. Blood type is either O, A, B, or AB. Okay. 4 blood types. And then after that, you either have a positive or a negative. Okay. So O positive is when you have RH positive blood. RH stands for rhesus factor. It comes from rhesus monkeys. We used their blood back in the day to help kind of figure out how to identify whose blood looked like whose. And that's how we came up with our system. Now, the reason why this is important is you can be a RH negative mother and have a RH positive baby. Now, what a lot of people don't realize is your baby's blood does intermix with yours in your bloodstream. Now, if you're an RH positive mom and you have an RH negative or an RH positive baby, there's no issues. For the viewer who asked, I'm RH positive with negative antibodies, what does this mean? This means your body doesn't make antibodies. When you're RH positive, your body just doesn't look at the baby as anything. But RH negative moms, when they see that foreign blood in their system from that RH positive baby, they view that as a foreign invader and they start making antibodies against that baby. Now, the first time anybody's exposed to an allergen and we make antibodies, a lot of times your allergic reaction won't be that bad. People, for example, you might have heard they got stung by a bee and the first time there was no reaction and the second time they swelled up. That's because the first time they were ever exposed, their body didn't know quite what to do with it, but it learned how to make antibodies so that every exposure after that, the body basically went crazy attacking that stuff. Well, this is what happens for RH negative moms. when they're pregnant with a positive baby, an Rh positive baby, their body can attack the baby, and it can actually lead to a miscarriage because it's a blood incompatibility, right? So when you have had any type of delivery, we need to go ahead and test the baby's blood to see if the baby is Rh positive. Because if the baby is Rh positive, then and you're Rh negative, then you need to get a RhoGAM shot. And the RhoGAM shot helps to prevent this incompatibility reaction. So to answer the question about the mom who had a miscarriage, you should be getting a RhoGAM shot within 3 days, 72 hours after having a miscarriage. So unfortunately, especially with early miscarriages, we can't exactly test the baby's blood. So we are just recommending across the board that all moms get the RhoGAM shot after any type of miscarriage. Now, if you deliver a baby whose blood can be tested, we do that first and make our determination from there. You'll also receive the RhoGAM shot usually during pregnancy, around 28 weeks. This is to prevent an Rh incompatibility with your baby that can also lead to jaundice and other things in the baby after birth. Okay, so this is why we do this testing. This is what Rh is about. It's very, very important. RhoGAM is a very, very important shot. It is not a vaccine, and I make that distinction because this can be a life-saving medication. This can also prevent future miscarriages. For those of you who are joining us, welcome, welcome. I really appreciate seeing you tonight. Please remember you can put any of your questions into the chat. Right now, I'm kind of going with some of the questions that we have gotten onto some of our videos this week. So I got a video on antibiotics during pregnancy. So this question said, why did our doctor prescribe metronidazole for BV? Now I feel I can't trust this doctor. So metronidazole is an antibiotic. Bacterial vaginosis is BV. Metronidazole gets a bad reputation. I know a lot of people are very hesitant to give metronidazole. There's actually not a lot of research to say that it is a bad antibiotic. It's very commonly used and it is extremely effective against bacterial vaginosis. In fact, the evidence shows that as long as it's used as directed for a short period of time, it can be safe. And it's a benefits versus risks type of situation. If you're giving any antibiotic to a woman during pregnancy, it's very important that we give the right antibiotic. Okay, there's tons of safe antibiotics, right? So amoxicillin, penicillin are the two that come to mind. They've been around forever. There's a lot of safety efficacy shown. But the thing is that penicillin does not work well against bacterial vaginosis. So I can give you all the penicillin in the world, and if it's not going to kill the infection, there's really no point to giving it to you. So sometimes we have to look at medications that maybe aren't ideal, but they can treat infection and do a good job. Remember, if we give antibiotics that aren't going to kill a bacteria, it just creates antibiotic resistance and makes it harder and harder to get rid of that infection. Now, a lot of people might be like, okay, but why is it a big deal? Well, most bacterial infections and yeast infections, if left untreated, can lead to preterm birth, stillbirth, and miscarriage. Urinary tract infections can do the same thing. It's funny because we get this very mild reaction, maybe a little itching, a little bit of discharge, and we just think it's no big deal. And it's what's happening is that bacteria is infecting your tissues and reaching up into the uterus, which is where your baby's placenta is. And eventually, if left untreated, it can be catastrophic. So just understand that it is used. Metronidazole is used for BV during pregnancy, and it can be very safe and effective because it's going to be a quick treatment. So, I think it's important to say that. Okay, so we got a very interesting question on my breast implants video. We don't get a lot of questions on this video. And I think this is a subject that's not very well, I don't think it's discussed very honestly when surgeons are doing breast surgeries with their patients. So the question was, can a fat transfer affect breastfeeding? Okay, so when you get breast implants, you get this, it's basically like a soft kind of squishy implant. It looks like a balloon. And you have the option to put it in front of your chest wall muscle or behind your muscle. Okay, so it can go in either direction. Some women don't want to put a foreign body into their into their body, right? Or foreign object into their body. Sorry. So what they opt for instead is to take fat from another part of their own body and inject it into the breast. Because it's their own fat, their body shouldn't reject it. Now, the way that this works in order to be used as a breast augmentation, it's not like you can inject fat on like one side and then you're done. What instead happens is they do a whole bunch of little micro cuts all around the breast to inject the fat. Now, the thing is, one of the things that women are told when they are getting breast implants is that it shouldn't interfere with breastfeeding because they're going to try not to cut the ducts. So you have these little uh the milk ducts are basically like balloons that hold the milk, and then there's a tube that goes out to the nipple, right? And so they'll say they're not going to cut the ducts, but these ducts are like microscopic. You cannot see them. It's not like you can take off the skin and see the ducts. They're tiny. So the problem is surgeons cannot see them in order to spare them, okay? And as a result, they have no idea if they're going to affect your ability to breastfeed. They just don't. So again, with the fat transfer and all these micro incisions, they could be cutting all of your breast ducts and they wouldn't be able to tell you that. Additionally, they're injecting fat in there. They don't know if they're injecting it into a milk duct. They can't see any of that. The other thing women should know is that we do not have an exact number of milk ducts. This is what I mean. I have 5 fingers. I am supposed to have 5 fingers on each of my hands. This is what I'm supposed to have. This is what all human beings have. Okay. When it comes to your breasts and your milk ducts, there is no guaranteed amount of milk ducts. It can vary from breast to breast. It can vary from person to person. So when you're having a fat transfer, one of the risks is that you could lose all of your milk ducts in the process. So can it affect future breastfeeding? The answer is yes. However, as far as the actual fat being injected into the breast, assuming that it doesn't affect any of the milk ducts themselves, it is considered safe. There shouldn't be any reason why your baby wouldn't be able to breastfeed as long as you're having a good breast milk supply. Hi, Chanel. Okay, let's see. I see your question. Can you catch certain colds if you're pregnant? So I am going to answer that question, but I hope I'm answering the question the way you want it to be. So, are there any specific viruses or infections that you can catch while you're pregnant? I mean, you can catch anything, just like anybody else, I guess is the best way to start. However, pregnant women are considered immunocompromised. So, what is immunocompromised? It means that your immune system is in a weakened state, kind of like a cancer patient. So, pregnancy is natural and normal. I don't mean to make it sound like pregnant women should like think of themselves as crippled. But again, when we lived in caves, our lives were very different. We weren't exposed to all these thousands of people we're potentially exposed to every week. And we didn't have to do the things that we did, and we didn't have a food supply that was tainted with chemicals. Our lives were different. Now, so we were able to withstand a lot more. Nowadays, you're considered immunocompromised. Your immune system has to be at a weakened state. And a lot of people don't understand why that is. So we're going to go back to kind of like the ROGAM discussion, and I'm going to get a little bit into vaccines, flu and COVID specifically, right? So your immune system gets exposed to a cold, and its job is to make antibodies to kill that cold and sends those antibodies out to do their job, kill the cold so you get better. When you are pregnant, if your immune system is on full alert, that baby is going to be recognized as a foreign invader. Your baby does not have your exact DNA. It has its own DNA. But that DNA is circulating in your system, and your body picks up on that and says, whoa, what's going on? What is this creature here? So because your body will recognize that, automatically nature, amongst the other changes that we go through, has said, wait, we need to calm down this immune system so that the baby will be okay. But when we calm down the immune system, we become more susceptible to illness. Thus, we are considered immunocompromised. Now, you might be saying, okay, but wait a second. Then why would we get vaccines? Because that means you have to inject some kind of part of the disease and then your immune system gets activated. I don't get it. So vaccines were not designed to prevent disease. They were designed to minimize the risks of hospitalization and death. They do prevent disease in some people, right? We've eradicated whole diseases like polio. But in the case of flu and COVID, it is absolutely not a perfect vaccine, either one of them. That's why you hear people say all the time, I got the flu vaccine and then I got the flu anyway. But what we have found is that these vaccines, if you're given it ahead of time, what you're able to build antibodies. So the next time you get exposed to that, your body doesn't have to take the time to build the antibodies. It already knows how to do it. It just goes and fights. Because all the time your body takes to figure out how to make antibodies, you're getting bombarded by that infection. Okay, so if it already knows how to do it, it makes it safer for you and you'll have less symptoms, less severe disease. This is also why they now have the RSV vaccine, and we have a video out on that, and we'll link that. That's the new vaccine that's out. It's FDA approved. The idea behind this vaccine is if you get it at least 2 weeks before delivery, your body makes all these RSV virus antibodies, and then passes those onto your baby. So when your baby's coming out, if your baby gets exposed to RSV, your baby's body doesn't have to learn how to make the antibodies. It already knows how to do it and can just go ahead and do it if it needs to. That's the point of a vaccine. So I don't know if that answered your question, Chanel, but please feel free to ask me something else about it if I didn't quite get to it. But that's a really good question. I like that question. Okay, so we had a video. We had a question on keto. So I'm going to go ahead and do this one. This one is super exciting for me. I talk about keto all the time. Is keto safe for breastfeeding? And do you have a video on weight loss while supporting a breast milk supply in general? So the answer to the second one is no, I do not. However, one of the things that I love to tell people to do is give me suggestions, okay? One of the things that I want to do for you guys is make content that you guys could benefit from, things that you want to see, okay? So I take these suggestions for sure, and I absolutely look at them as, future ideas. So that is definitely going to be one that I add to the list. However, I can talk about keto. So the ketogenic diet is basically high protein, high healthy fats, and low carbohydrates, which is low sugar, okay? This is a extremely effective diet for losing weight and getting healthier. The idea behind it is if you are eating less carbs, your body has to use up some of the sugars that you have stored in fat on your body that helps you lose weight. And what you're trying to do is go into ketosis where you're burning off some of those carbs. Now, it's kind of basic, right? The ketogenic diet, if you do it the right way, involves, amongst other things, looking at the carbohydrates on the packages of food that you eat and calculating macros. There's different ways of doing this. I personally don't recommend the calculation of macros to most people. I think it's complicated and it ends up making it very discouraging to do keto. And you can do something called dirty keto without doing all of that. And part of dirty keto, for people that at least want to calculate a total number of grams per day, they'll say they're going to do 20 grams or less, or sometimes 25 grams or less of carbohydrates in a day. So you can just look at the back of things that you eat, calculate a serving size, and voila, you can figure it out. I like to say dirty keto, which is basically find a keto-friendly food list online. So what foods can be included in the keto diet, and kind of eat off of there. Okay. You're going to find that they're, you know, the fruits are more like berries, like strawberries and raspberries, stuff like that. You're going to also find that you have a lot of the green vegetables. You're not going to find a lot of like wheat products and stuff like that. You'll have some dairy in there, lots of protein, lots and lots and lots of protein. Nuts, that's one of the healthy fats, that kind of stuff. So that's your kind of basic on keto. And one of the reasons why I think keto is so effective is when you look at it at its root, here I go again, it's the same type of foods we would be eating if when we were in caves. We were nomads. We went from place to place. The primary part of our diet was protein and fats, usually from animals. So we ate everything from an animal, and that consisted of like 80 to 90% of our diet. Okay. Now, going on to the question of, is keto safe for breastfeeding? So there is we can't do research on medications. We can't do research on diets. We can't do research on lots of different things for anybody who's pregnant or breastfeeding. It's not considered ethical. So there's not a lot of data out there to figure out whether it's safe or not safe. In theory, it really should be fine. Okay. However, one of the 10 amounts of keto is to get into ketoacidosis. And if you get into ketoacidosis, you're basically burning off sugar and it turns into fat, and it turns into ketones, and ketones can become toxic, leading to ketoacidosis. Ketoacidosis is very often, if you're not purposely trying to do it, a medical emergency that is the first sign that somebody has diabetes when they didn't know they had diabetes. A lot of type 1 diabetics, that's how they get diagnosed, is that they end up in an emergency room in a ketoacidosis emergency. When you're talking about breastfeeding, because you have all this kind of nutritional pull that's on you to make good quality breast milk, there seems to be some evidence that women who are breastfeeding are at higher risk for ketoacidosis, which can be a medical emergency. So generally speaking, they don't recommend true keto. Now you got to understand, what I'm telling you is for the person who's sticking to the macros that I was talking about, and very strict, and usually under 20 grams of carbohydrates per day. The recommendation usually for a breastfeeding mom to maintain her milk supply and avoid any kind of emergency is to stick towards closer to the 45 to 50 grams of carbs per day, and to stick with like a keto friendly type of like food list. Okay. Because that's usually what's going to be better. It is probably not ideal to be trying to do keto if you've never done it before while breastfeeding, but dirty keto probably would be okay. Now, the other thing that I want to tell you guys about keto, because I might have just not sold it for you, but not everybody's breastfeeding, and eventually not everybody's going to be breastfeeding. I am very pro keto. Okay. So this is one of the amazing things about the keto diet, and this came out today. Okay, so I am now going to be looking at the article that I read earlier today. So if I look a little weird, that's why. The keto diet has been approved now, or the keto diet was studied in infants as an alternative treatment for epilepsy. Epilepsy, if you guys don't know, is seizures. And for babies who are born with epilepsy and were treatment resistant, that means they had tried 2 or more seizure medications that had not been effective. They tried the ketogenic diet with these babies, and they found that the babies in the keto group were having 5 seizures at 8 weeks, 5 seizures per day, versus the kids in the seizure medication group, which were having 3. That's basically considered the same. So they are starting to look at the fact that the ketogenic diet might be a very viable treatment, or a treatment in tandem with medication for kids with seizures. And the keto diet has been actually used in the adult epilepsy population for many years, and it's been shown to be extremely effective in helping to manage seizures. Additionally, we also have found that the ketogenic diet can help with a lot of other different medical conditions. So I definitely think that the keto diet is something to definitely look into, and it's something that you guys should be really embracing and learning more about. Tess, is intermittent fasting in general, but specifically 14-10, okay for breastfeeding? Yes, in general, intermittent fasting is okay. Stay hydrated. It should be totally fine as long as you're eating, your normal, like a normal healthy amount. You don't need to overeat or anything. Even if it's, so just so you guys know, for anybody who doesn't know what intermittent fasting is, it means for a certain amount of hours per day, you're not eating. And then the other hours is like your eating window. So I believe she's saying her fasting where she's not going to be eating is 14 hours, and her window for eating is 10. And windows can be as little as 6 and can be as high as 12. So when it's 14 hours, remember, some of that is your sleeping time. When we're asleep, we're naturally fasting. So most people, what they do is, for example, if they sleep 11 to 7, which is already 8 hours, maybe they stop eating at 8 and they start eating at 10 the next day or something like that. That's what intermittent fasting looks like. Now, what I will tell you, and this is controversial, everybody's a little bit different on what consists of fasting. Some people will say that you can fast and still ingest anything that is 0 calories. And very specifically, they're talking usually about coffee or tea with an artificial sweetener. Okay, so you cannot, in my opinion, use any artificial sweeteners, even if they're 0 calories, while fasting. Once you have an artificial sweetener, which is kind of sweet tasting, hit your tongue, it sends a signal to your body that you have started to eat, and it will produce an insulin response. That insulin response breaks your fast. Okay, so even though you've had 0 calories, your fast is over and your body is starting to do what it needs to do. So if you want to be truly fasting, it has to be water, black tea, or black coffee in the morning and nothing else. And that's a fast. So that's a good question. You're welcome, Tess. For those of you who are joining us, I'm Dr. Samantha, the maternity mentor. We're here again. Please feel free to put your questions into the chat. That's what I'm here for. And I'm also answering some of the questions that you guys have put onto the videos this week. So I got a question about C-sections, and it said, is it true that if I had all 3 of my kids via C-sections, I can only have 3 kids? My family keeps telling me to tie my tubes because I will have complications or baby deaths after my 3rd C-section. So this is a loaded question. Okay, so the bottom line is no, that is not true. However, it might be true for you. So is there a certain limit to how many C-sections you can have? No, there is no set limit. There's no number out there. However, one woman might be able to only tolerate 1 C-section, and another might be able to tolerate 10. There's a lot of factors that go into how many C-sections you can have. For starters, the quality of the surgery you had. Okay, let's just be honest. If your C-section had, and I know these look small, but just go with me. If your C-section on your uterus, that's the inside part, not your outer part, inside where the baby was. If the cut was this big versus this big, okay, the mom who has the smaller cut is going to be able to have more C-sections. The mom who has the larger cut, it's going to be a lot harder because more of the uterine wall has been like opened and now has to heal because of this larger cut. So that's number one. Number two is how much baby spacing took place. Now, for those of you who don't know what baby spacing is the amount of time in between children from the time you were giving birth to the time you become pregnant again. The WHO recommends that women don't become pregnant for at least 2 full years after having your baby. And I want you to make sure you heard that. Become pregnant, not to give birth, to actually start the pregnancy process, because your body needs a chance to heal. Ideally, you are having a full year to heal and to take care of your baby. And then the second year, ideally, you're continuing to breastfeed your baby. So during that time, they don't want you to be getting pregnant or anything. Now, forget about breastfeeding or any of that stuff. You guys know I'm very pro formula. You know, we are living in a society where we are not as healthy, where we are much more stressed, where there's a lot of stuff on our plate. So your bodies are probably not in an ideal situation to begin with, which makes it even harder for you to have a healthy pregnancy if you're going back to back to back, and now you add in a C-section. So the further your pregnancies are spaced out, the more time your uterus has a chance to heal. Now, the third thing has to do with how your pregnancies were. So when you have pregnancies that have complications like diabetes, which can cause the baby to be exceptionally large, a large baby stretches those uterine walls. That's not good for the uterus. If you have something called polyhydramnios, polyhydramnios is too much amniotic fluid. That can be caused from diabetes, but it can also be caused from a baby who has kidney issues, right? Again, it stretches the uterine wall. Well, the uterus is amazing and it will contract back down, but it never is the same after each baby. And over time, all of that stretching can thin out the uterine wall, and then it can lead to the risk. And the risk is a uterine rupture. Ultimately, what can happen is the uterus can rip open, right, at the site of that old C-section scar, and then you bleed out. Okay. And that's a medical emergency for both you and for baby. And I think this is what your family's worried about, is they're worried about that uterine rupture or even a postpartum hemorrhage. And we have a video on postpartum hemorrhage. We can link that into the description. But this is where you're having heavy bleeding after pregnancy. Now, that's related to C-section specifically. They may also be worried about other comorbid factors. Maybe you had complications during your pregnancy, like preeclampsia or something like that. That's another story. Ultimately, the choice to have more babies is something that you need to discuss the safety of that with your healthcare provider. You need to have them help you understand what is going on and what the risks are from having another baby and another cesarean section. Okay. We had a couple questions on yeast infections or like different fungal infections. So the first one was, I'm 29 weeks pregnant. Can I use clotrimazole 1% external cream to cure ringworm? So this is a great question. So clotrimazole is a fungal cream, right, that we use for different kinds of yeasts and funguses on the skin, ringworm being one of them. Now, clotrimazole is also available as an oral tablet. So just so you guys know, you may have heard about it as being used for something else. I believe you can see it in yeast infection for like vaginal yeast infections as well. Clotrimazole is safe whether your person is seeking treatment. Now, if any of you guys suspect you have something going on when you're pregnant, you can't just go into the store and grab stuff off of the shelf and just take it. Not when you're pregnant. Not everything you see that's on those shelves is safe for you to take during pregnancy. And this is something a lot of people don't realize. So make sure you guys are getting stuff checked out. Here's a great example. How many people, when they're pregnant, have heartburn? Oh my gosh, like everybody, right? And there's all these antacids over the counter. And what do we hear? We hear people say, oh, my doctor recommended Tums. Oh, my doctor recommended this, right? And they may have. Some of those antacid remedies that you find on the counter, over the counter, are completely safe. They're completely safe. And others are extremely harmful. For example, the ones that contain aluminum. This is a great example of many examples that you can find where you need to ask your healthcare provider before you just take something that you find on the shelf in the drugstore. Okay, so I'm really glad that this viewer asked, but it's very important that you guys do get stuff checked out and make sure you know what your healthcare provider wants. Another question that we got was, if I have vaginitis, can I have a normal labor and delivery, or do I need a C-section? So this came in on the yeast video as well. So vaginitis, itis is irritation. Okay. So if you ever hear itis at the end of something, like conjunctivitis is an inflammation of the conjunctiva, which is the red part of your eye. Okay. What is it caused by? Usually by a little infection. Some itises are caused by infections. Others are just irritation. Vaginitis, which is inflammation of the vagina, can be caused by a variety of different infections. Now, just because you have vaginitis does not mean you have to have a C-section. In fact, quite the opposite. Usually they'll just try to treat it. We'll swab you, we'll figure out what's going on, and we'll treat you. If you were to have, say, chlamydia, which is a sexually transmitted disease, we would actually go ahead and we would just treat the baby as well when the baby came out with some antibiotics. I mean, it would be as simple as that. Now, there are a couple things that we cannot deliver you vaginally for. One of them, because we're talking about vaginitis, which is irritation of the vagina, is a live herpes infection. So if you have a live herpes infection with herpes lesions on the vagina, vulva area, we will not recommend delivery vaginally. So your risk of passing herpes to your baby, if you have a vaginal delivery with an active herpes lesion, is very large. Your risk of passing it to the baby by a C-section is like 1 or 2%. Herpes infection in a newborn is deadly. It is deadly. I have unfortunately had a personal friend who lost their baby at 10 days old from a herpes infection that nobody knew was there. It was not something that was readily available or diagnosed. So it was unfortunate. And it's extremely sad to see this happen. And we can prevent it through C-section. So just understand that if you ever have this come up in your personal history where they're recommending a C-section for that particular reason, I encourage you and urge you to have a C-section. But for just vaginitis with no obvious infection that is deadly to the baby, there's so many things that we can treat nowadays. And the reality is a C-section is dangerous for moms, more dangerous than having a vaginal birth. There's a lot more risks involved. So we want to only have C-sections when we need to. But please don't be scared of C-sections. A lot of them can be amazing. And I have a whole bunch of videos to prepare you on a C-section if you have to have one. And I think this brings me into a great segue for our last question. If you guys have any questions, please feel free to put them into the chat. But this one is kind of probably one of those things that can lead into a C-section. So it's about induction. And she writes, I'm 37 weeks and 2 days pregnant, and there is a problem with my umbilical cord, which is providing less blood supply to the baby. My doctor suggested to induce and to deliver the baby as soon as possible. Could you please suggest what to do in the meanwhile? My baby's movements are quite good. So, one of the things that's important for a healthy pregnancy and a healthy baby is a healthy, functioning placenta. So you have the uterus, and when you get pregnant and the baby comes into the uterus, the placenta attaches to the uterine wall. And so this part of the uterus wall is like a whole bunch of blood vessels, and this part of the placenta is a whole bunch of blood vessels, and they kind of mesh together. And then what happens is nutrients and all the oxygen and everything go to the baby. They go through the placenta and into the umbilical cord and into the baby. And then out of the baby is all of the toxins and everything else, and it goes through the placenta and into our system where the filters for that stuff. Okay, so that's how that works. When the placenta stops functioning and the umbilical cord stops functioning, the baby is no longer getting good nutrients and the baby is no longer getting good oxygen. Unfortunately, there are a lot of different conditions that can cause this: preeclampsia, diabetes, um, uh, uh, sorry, advanced maternal age, kidney failure, lots of different things. Once this process starts, unfortunately, we can't stop it. It just continues to get worse. That's why we'll start to monitor moms closer and closer. And we will usually deliver at 37 weeks, because at 37 weeks, we're likely to prevent any kind of catastrophic issues like a stillbirth. Okay. We don't want to let the baby go too long, because then the placenta might completely fail. Okay. So what can you do in the meantime? If you have diabetes, watch your sugar, eat right. If you have blood pressure issues and preeclampsia, check your blood pressure, take it easy. But there is nothing you can do to fix the actual placental function. And what you want to do is to just keep monitoring your baby's movements and just, keep making sure everything is going well. So that was all of the questions that I got on the videos today. If any of you guys have any questions, please feel free to put them in the chat. One of the things I want to let you guys know, as we're wrapping up, I look at all of your questions and comments. I take it very seriously, and I think it is extremely important to go ahead and answer these questions. But also, I look for suggestions from them. So please feel free to put suggestions onto videos. I look at them. Hi, Isha. Is the whooping cough vaccine safe? Yes, it is safe. Okay, it's been used now probably for a decade. It's very effective. For those of you who don't know what whooping cough is, because a lot of people are a little confused by why they would get this particular vaccine. So whooping cough in adults is like nothing. Okay. In fact, a lot of us, when we get whooping cough, we're asymptomatic. That means we don't even get any symptoms. And adults that get symptoms it's usually like a cold. We don't even have a cough. Okay. So it's not like this huge deal for us. But for babies, whooping cough can be deadly. And I live in the South Florida area, and whooping cough is endemic here. That means it's in the community. And we've had many, many babies die down here because they were exposed and they were unable to fight that off. Babies are also considered immunocompromised when they are born. So that means that they also don't have a strong immune system to fight things off. So whooping cough, the babies cannot get the whooping cough vaccine right away because it's a live vaccine. So with a live vaccine, we have to inject somebody with a little teeny tiny bit of live virus. That means it's slightly more, I don't like to use the word dangerous. So it's like a slightly more aggressive virus. You need an immune system that is able to combat a tiny bit of live virus so that you don't actually make the person sick. And newborn babies don't have that. So we have to wait like 6 or 9 months for a baby to be eligible for that vaccine. So what do? We try to help prevent it. First, when mom gets the vaccine, she gets protected from whooping cough. So she can't get the baby. She also develops antibodies that can be passively passed to the baby through the placenta, also potentially protecting the baby that way. And then what we also like to do is we recommend partners and babysitters and all sorts of people who are going to be exposed to the baby also get their Tdap vaccine. So I actually, as a nurse, when we were working in the hospital, we had to all get the Tdap vaccine to help protect us from getting whooping cough and bringing it into our patients. So that's how seriously hospitals take it, is we want to make sure we're protecting our babies. So that's a good question. My 9-month-old only breastfeeds 3 times a day, but also is a really good eater, eating 3 solid meals a day. Is only 3 times a day normal or okay for this age? So whether you're talking about breastfeeding or food feeding, yeah, the answer is both. Um, by the time a baby is by like 9 months to 12 months, especially if the baby is a good eater, babies are starting to move into a pattern that's closer to adults. Okay. Babies probably should be offered some snacks in between if they seem to be hungry, but nothing like what we are, it shouldn't be like 5 full meals a day. And honestly, breastfeeding at this point in time, they're getting most of their nutrients from the food, and the breastfeeding is like their bonus. It's almost like dessert. The only thing I would say to that pattern is make sure the baby is getting water. Okay. We often forget, I think that at this point in time, the marketing of don't give your baby juice has kind of hit home. Most people know, and if you didn't know, don't give your kids juice. Juice is empty calories. It is absolutely, there is no point to juice at all. There's not even points to making your own juice. A lot of people say, oh, but I make my own juice. No, it's better to eat the fruit and just drink water. Okay. So for babies at that age, the only thing I would say is offer water as well. Just like you would offer water like at a meal for an adult, you would do the same for a baby who's eating, right? If you're out in the hot sun, you offer some water in addition, because once your baby is over 6 months of age, they can drink water. Under 6 months of age, no water should be given, period. The other thing is you don't want to offer too much water, okay? Too much water can be a very bad thing. Water is ultimately based off of your baby's weight. So if you want to know the specific recommendation for your baby, you have to ask the pediatrician because it's based off the weight. But like I see Tess said 5 to 10 ounces a day, that's totally fine. What you wouldn't want to be doing is giving like 30 ounces of water a day. That would be absolutely ridiculous. But 5 to 10 ounces is fine. And you can let your baby kind of be self-led or they let them tell you how much they need. Offer them 3 or 4 ounces and she can eat what she wants or drink what she wants to drink out of it. Yeah, that's probably right. 5 to 10 ounces is probably right. So, and that pattern of feeding is great. A lot of people choose to do baby-led weaning in a lot of places. Baby-led weaning is basically where you allow baby to eat what looks good to them when they want it, stuff like that. It's very much encouraged nowadays to let babies eat the same food that you're eating. Whatever you're eating, let them eat it. We don't need to puree our foods to death like we're so used to seeing. The only thing is, if you're going to allow your baby to say eat a little bit of, say, salmon and a little bit of rice while you're eating salmon and rice, just want to make sure the baby's supervised. That's it. For those of you who are here, if you have any questions, please feel free to put them in the chat. I have told you guys that for those of you who waited until the end, I'd give you a sneak peek at tomorrow's video. Tomorrow is part 2 of our 2-part series on cosmetic procedures that you can have while you are pregnant or breastfeeding, or can you have them while you're pregnant or breastfeeding? Tomorrow's is very exciting. We talk about tattoos and piercings and other things. And one of my most favorite, and I think the most eye-opening, eyelash extensions. That was a good one. So please check that out tomorrow. If you haven't done it already, please like and subscribe to the channel. Subscribing really helps me out. Hit the notification bell so you can get notified of our latest content. Share the channel with your friends and family. Follow us on Facebook, Instagram, and Twitter for additional content. Please feel free to put any of your comments, anything that you are interested in seeing in the chat or on the videos. We really look at them. I look at them all the time. I'm usually the one answering those comments, and I really look forward to interacting with you guys. We are here every Monday at 9 p.m. Eastern Standard Time. This is where you can find us. The next 2 Mondays are holidays, but as of right now, we are probably going to be here and answering questions. But if we decide to change our pattern, we will let you guys know on the channel. You can definitely figure out when our next live is because we post on Facebook, Instagram, and Twitter, letting you know when it's about to come out. So I hope you guys are all well. I am Dr. Samantha, the maternity mentor. I really appreciate all of you coming tonight. Thank you so much. Bye for now.